Welcome to this explainer. Today, we are diving into a fascinating 2020 public health study that literally flips the script on how we manage childhood asthma. If you're a parent, a caregiver, or honestly just someone who follows public health, you know exactly how incredibly stressful asthma can be. So let's get right into it and look at a pretty massive twist in how we deliver life-saving medication to kids. Section 1. The childhood asthma crisis. Let's take a look at the true scale of this problem. Just take a look at this number. Right now, in the US alone, over 6 million children under 18 are dealing with asthma. 6 million! We're talking about missed school days, lost sleep, and a whole lot of severe anxiety for families. But honestly, the most alarming stat here, this condition leads to nearly 500,000 hospitalizations every single year. Which brings us to a genuinely puzzling question, right? If we have these highly effective rescue medications out there, like albuterol, why in the world are so many kids still suffering severe attacks and ending up in the emergency room? Why exactly are these tools failing our kids at the exact moment they need them most? Part 2. Inhalers and the spacer myth. Let's examine the tools we're actually using. So for years, this simple plastic tube called a spacer has kind of been the presumed hero of pediatric asthma care. And hey, the logic makes perfect sense. You attach the chamber, pump the medication, and it holds the drug in the air so it doesn't just hit the back of the child's throat. It was basically thought to practically guarantee that the medicine makes it all the way down to the lungs. But wow, here is the plot twist. This data tracks albuterol used by children aged 7 to 12. It compares the kids who used a spacer to those who didn't. And what did researchers find? There was absolutely no statistically significant association between using a spacer and the number of doses successfully inhaled. So yeah, the spacer, it is not the magic bullet we all thought it was. So the really crucial point here is this. Giving a kid a spacer is a lot like giving someone a really complex, highly engineered tool, but totally forgetting to give them the user manual. It just doesn't automatically solve the problem if their core inhalation technique is fundamentally flawed from the start. Because if a child cannot coordinate their hand to press that inhaler while simultaneously taking a deep, perfectly timed breath, well, all the plastic tubes in the world aren't going to push that medicine into their airways. A great tool simply cannot replace correct technique. Section 3, the real game changer. So what actually moves the needle? Look at this huge shift in the data. It reveals our true hero here, and that is professional inhalation instruction. The study showed a staggering correlation between receiving hands-on training from a pro and a massive drop in severe asthma episodes. It turns out when a healthcare professional actually takes the time to sit down and teach a child proper hand-breath coordination, the results are just absolutely staggering. Let's zero in on this specific number because it is honestly incredible. Out of the kids surveyed in this study, exactly 340 children who received professional inhaler instruction had absolute zero. Let me repeat that, 0 asthma episodes or attacks in the measured time frame. Meanwhile, the kids who didn't get this instruction, they were experiencing frequent, sometimes dozens of attacks, sending them straight back to the emergency department. The contrast here is just undeniable. On one side, you have a child with professional training who is totally empowered. They have high self-efficacy, they can manage their symptoms, play sports, sleep soundly through the night, and basically just live a normal life. On the flip side, a child who's left to figure out this tricky device all on their own faces frequent emergency room visits, they're missing school, and their daily life is severely restricted. It really all comes down to education. Number 4, changing patient behavior through the trans-theoretical model. Now, public health experts use something called the trans-theoretical model of change to understand how to guide a child from poor asthma management to having perfect inhaler technique. Because, this isn't just about breathing. It's heavily about psychology and building good habits. We really have to guide kids through these specific psychological stages. It's a whole journey. It starts from pre-contemplation, where they might not even realize their technique is poor, all the way through contemplation, preparation, action, and finally, maintenance. That last step is where they practice with a pro until that perfect hand-breath coordination becomes pure muscle memory. Section 5, actionable steps for parents and caregivers. So, what do we actually do with all this data? Well, first things first, have a medical professional evaluate your child's specific device proficiency. Watch them actually use it. Second, do not just rely on the spacer to do all the heavy lifting. Third, focus heavily on that hand-breath coordination we talked about. And finally, Make sure you administer controller treatments even when they feel completely fine, just to stop those future attacks right in their tracks. I absolutely love this quote from the research. It's such a great reminder that you don't have to sit around waiting for a doctor's appointment. Your local pharmacist or clinician is your most accessible and valuable asset in the fight against childhood asthma. So hey, the next time you pick up a prescription, don't just grab the bag and walk out the door. Stop and ask the pharmacist to demonstrate the correct technique to your child right there at the counter. It's a total game changer. To wrap things up, I want to leave you with a provocative thought for today. Really watch your child use their inhaler. Do they truly know what they are doing, or are they just kind of going through the motions? Because as the data clearly shows, mastering that technique is literally the difference between a happy, normal day at school and a midnight trip to the ER. Thank you so much for joining me in this explainer. Now go check those techniques.